Most of you do know Dr. Tausif. He's quite the favorite and hit. But for those of you who don't, and this is your first time, Dr. Tausif has been associated with the specialty of emergency medicine for the last 20 years. He is currently the Vice President, Medical Operations for Health, Red Health, and formerly he also held the position of Medical Director and General Manager of Neura, AI-enabled imaging and expert healthcare. Dr. Tausif is a strong exponent of ethical, guideline-based, patient-centric practice. He has presented papers at various conferences and published 8 papers in international journals. Wow, that's wow, amazing. And also, I must say, Dr. Tausif is one of those doctors who uses both sides of his brain. Apart from all that is listed, he's also been he was a radio jockey for over 10 years, hosting a primetime show every day with 2 popular radio stations in Chennai, named Fever 91.9 FM and Chennai Live 104.8 FM. So without wasting any more time from me, I'm going to dive straight into why we are here today for the webinar on bone health. Something we all know that is important, but life gets in the way, and most of us, including me, we tend to make excuses and then realize that it is important when our body starts telling us. So today we have Dr. Tausif, who is going to talk all about bone health, especially for older adults.
Thank you, Chitra. Pleasure as always. Yes, so we're going to be talking about bone health for older adults. This is how the life cycle of our bone generally happens. Yes, as we grow and reach 30 is when we are peaking both in terms of bone mass and muscle mass, both for female and for males. And then from 30 onwards, unfortunately, it starts going downhill. We start losing bone mass and muscle mass as we go from 30 to 40, 40 to 50, and so on. For women, unfortunately, as they touch menopause, this dip in bone mass and muscle mass is exaggerated. For men, thankfully, not so. And then there's a little more gradual decline for men. But for women, there's a faster decline post-menopause. So we find that women are more at risk to have sarcopenia, which is decreased muscle mass or muscle strength, and also osteoporosis, which is decrease in bone strength. Now, the good thing, though, is this is not a given. It's not that you will always have to go through this cycle. You can change this cycle, and this is what science says. So like I said, as we are growing older, our genetic peak bone mass is already determined by the DNA that we have, and that is what you're seeing on the green line. Okay, so our green line determines that we reach a certain bone mass or a muscle mass based on our genetics. I know our parents, their build, how they were, and which kind of race we come from, and then that determines that. But this can become red. If our lifestyle as we grow from 20 to 30 is not great, then we will not reach the peak bone mass and muscle mass, which is already predetermined by our DNA. That is the first problem. And this is for younger people. When they are growing, if they're not indulging in a healthy lifestyle, they may not reach what is already earmarked for them in terms of muscle strength and bone strength. But that's fine. You have reached your peak bone mass and muscle strength at 30, and then now you are progressing through life. Even here, as you notice by the green dotted line, if you remain involved in a healthy lifestyle, you can continue to buck the trend. You can avoid the decline that happens in muscle mass or bone mass by continuing to have a great lifestyle, which is primarily exercise and a healthy diet, and avoiding things which lead to osteoporosis or muscle wasting. This is the good news. So staying active, staying healthy, eating the right food, and avoiding substance abuse or any other form of injury to the body can allow us to continue to have great bone and muscle mass as we grow older. If you're looking at, say, a Shah Rukh Khan or an Amir Khan at this age, the fact that they have exercised so much and kept themselves fit allows them to still walk around and do movie roles where they are pretending to be young guys romancing young heroines. right? So this is what is allowing them. If they were not exercising, let's talk about our yesteryear heroes, where Shivaji Ganeshan, because I'm from Tamil Nadu, right? They at some point had to shift when they reached the 50s and 60s on to senior roles. And not continue to romance young heroines. So the current heroes are bucking the trend, and this is how science explains that. Right. So how healthy are our bones today? Where do we stand in terms of bone strength? Okay. The burden of osteoporosis. It's an enormous burden worldwide. Globally, people over 50 will suffer one osteoporotic fracture. That is, one out of every three women in the world will suffer an osteoporotic fracture after the age of 50. Now, what is the difference between an osteoporotic fracture and a regular fracture that people have after falling down or having an accident? Now, a regular fracture needs a considerable amount of force. You have to be, say, riding a bike, or you have to fall from a height for the fracture to happen. But in osteoporotic fracture, just takes trivial trauma. Trivial trauma, you try to lift something, the fracture can happen, right? This is because the bone strength has become so weak. And that is a pathological fracture. And that is something that we can prevent and avoid. Right. So an osteoporotic fracture, one in every three women above the age of 50 suffers an osteoporotic fracture across the world, and one in five men. And that leads to 8.9 million fractures annually. That's 89 lakh fractures annually, and one osteoporotic fracture every 3 seconds. In fact, when we take data from 1990 and we then extrapolate it all the way to 2050, hip fractures in the world will increase by 310% in men and 240% in women. That is scary, right? That is scary. And we want to avoid that. The good thing is it is avoidable. And what does it mean for the elders? Loss of independence. After a fracture, somebody cannot climb stairs or do things that they independently used to do before. And research or evidence says that elder people, when they have an osteoporotic fracture, they have a very high mortality rate. 30% of people, unfortunately, pass away after an osteoporotic fracture, which is why we have to avoid these fractures and keep our bones strong and healthy. So as you can see, what happens post-fracture, only 20% recover completely. 50% only have partial recovery. The remaining 30% don't recover at all. And then their life deteriorates, ending in death. So that is why we have to avoid these fractures. Okay, it is a global crisis. It's not something located to a particular region. Like I showed you, the hip fracture incidence will increase. Number of people at high risk of fracture is also going to double by 2040. From 158 million, it's going to go to 320 million. And it's a growing burden in all parts of the world, be it Latin America, be it Asia, be it Europe or North America. Everywhere, this is a growing burden, right? Everyone is facing this particular problem. And it's not just a physical or a health related issue, it's also a socio-economic problem, because treating this costs billions of dollars, billions of dollars. Anybody with a fracture has to go to the hospital, get themselves treated, has to go through expensive surgery. And of course, all the rehabilitation, medication, everything together is going to cost billions of dollars any part of the world. And there's also a cycle of impairment and fracture. So once there's a fracture, there's pain, and then people don't exercise or walk properly. There's changes in bone structure, inability to perform physical activities, trip and fall again, and again fracture. So you don't do the physical activity, no muscle, balance is lost, and people have a fracture again. So it's a very vicious cycle, right? So that's why prevention in this case is definitely better than cure. Okay, right. Even the doctors are unhappy. When we talk to bone specialists, they estimate that over 200 million people worldwide will be affected. It's a silent epidemic. 66% of bone specialists feel that osteoporosis is a neglected condition. And 24% of bone specialists believe that the healthcare system is not prepared to handle osteoporotic patients or support them, in fact, or work towards prevention, right? And almost everyone agreed that this should be a top public health priority. That's why a lot more focus on bone health is happening, if you notice, these days, because these are preventable, and we can continue to have our elders enjoy a very good quality of life as they age if we can protect their bones and muscle mass. that itself will give them a great quality of life. So what is the cause of all this? Well, we know lifestyle, but it's not just lifestyle. Okay. So we have modifiable and non-modifiable risk factors. The non-modifiable risk factors are advancing age. Obviously, like I said, our genetic makeup of the body itself is against us. After the age of 30, we are going to start declining in that, but we can prevent it by exercising. Female gender, after menopause, women are more affected because they lose the hormones that protect or prevent bone loss. Asians are more prone. We are not Asians, thankfully. Low peak bone mass. This is what I was talking about. How strong are your bone at the age of 30, right? If we have had a great lifestyle, we will reach the genetic bone mass, the peak bone mass that we have had, should have had. If you've not lived a great lifestyle and not reached a peak bone mass, which is a good bone mass, then our chance of osteoporosis is faster. Family history of osteoporosis. If you had somebody in the family who had history of osteoporosis, well, then there's a high chance somebody will have. Supposing you had a fracture previously, then again, there's a risk that the bone density in that region will be less. Also, if you're generally not well built, your BMI is on the lesser side. So all those people who want to stay thin, well, they should think about this. All right. Having a good BMI is good. It protects you. It keeps you healthy. And that's why all our mothers are always saying, eat more, you're looking very skinny. So, we should listen to our mothers now more. Okay. Modifiable risk factors are smoking. Right? Smoking is very bad for the bone. Inadequate calcium intake. Now we know all of this. Inadequate vitamin D. And I will surprise you with something about vitamin D, which is very recent evidence. And it has changed the way I also practice this. Low body weight, if you can change that, it is great. Hormonal changes, hormonal deficiencies, endocrine related problems, chronic use of steroids. People who use steroids long term, right? Sometimes when you have a lot of knee pain, doctors say they'll give a steroid. No choice, right? It kind of relieves the pain. But if you keep on using this, even the doctors know that the bone around that region will become weak. Okay. So these are some, and there are more also. There are other drugs that can have. Alcohol also is a big problem. Anticonvulsants, anticoagulants, thyroid replacement therapy. So these are some of the other problems that can be there, and some other medical conditions also can be risk factors for osteoporosis, right? So how do I prevent osteoporosis by creating a better lifestyle? So we have to give up some old habits and have some new habits. I'm going to just briefly touch on this, and then I'm going to go to diagnosing osteoporosis, because I know this is the area where you might have a lot of questions during the interaction. Okay. Well, this is something to motivate all of us. I don't know how to pronounce her name, but I think it's Hildegard Berkeley. She was born 1934, and she set a new European record for women's 100-meter sprint in her age band, right? And this was in 2014, and you can look at her, like she's running super fast, and her timing was about 13 seconds, 13 or 14 seconds. I'm not sure if I can run 100 meters at that speed. Okay, that's 13 seconds is a pretty good speed, and she's setting an European record for this, right? So that's why the quote from C.S. Lewis: "You're never too old to set another goal or to dream a new dream." So we can all get there. So that's pretty much doable. So the first thing is exercise. If you want to keep your bones strong, you have to exercise. If you have a sedentary lifestyle, there is going to be age-related loss of muscle mass. And that will lead to its own set of problems: diabetes, obesity, blood pressure, depression, and also an increased risk of falls, because you are not physically strong, so you can fall. And also there is decreased recovery, higher, they cannot, health-related issues, they are unable to heal faster, right? And of course, and the lesser exercise means more obesity, and then again this makes you more slow, more sedentary. And that's why we need to have an active lifestyle. And this is the whole concept of active aging that Silver Talkies really works on. I had the opportunity to give a talk on active aging also at Saksham. I think that was my talk on. So when you have an active lifestyle, there is, for a longer duration, there's a sense of well-being. Your functional capacity is always, great. And all these problems that I talked about are delayed. And the lifespan is longer, and the quality of life is greater. Now, when we always talk about Japan and say that Japan has the highest number of people above the age of 100, and also the average lifespan in the world is highest in Japan, where it's about 84 years, and India it's only 69. people tend to think, oh, they're older people, so medical expenses also must be high. They go to hospitals. Surprisingly, that's not the case. They've also done research on that, and the older people are not increasing the healthcare burden in Japan. They do health screening from the age of 20, 24, and then they're doing it all the way till, once they retire from the age of 65, the government then sponsors their health screening. Okay, so every year they're annually getting a health checkup done, which is a very comprehensive health checkup, and they are always walking. If you go to Japan, you see everyone walking. Even the oldest of people will be doing their own work, right? They'll be going, cooking, cleaning around the house, and this is actively, not because they don't have anyone to help them. There are a lot of volunteers who love to help, but they do this on an active level, right? So this is how they have a great quality of life with a longer lifespan. So when somebody wishes us 100 years, I always say 100 healthy years, please, right? This is what we all want to live. Okay. So what exercise is helpful? So we can lift weights. Yes, weights are very good because that's how we maintain our muscle. But if you're unable to do weights, there are many other things you can do, like carrying groceries. If somebody has knee problem, I wouldn't tell them to walk up the stairs. But if you don't have a knee problem, then you can climb the stairs, or a heart problem for that matter. Lifting your own body weight basically is, do push-ups against the wall. You don't really have to do floor push-ups, but you can do push-ups against the wall. Keep your body slightly slanting and do push-ups against the wall. Use resistance bands. There are resistance bands. You don't need to really lift weights, and then you can use those resistance bands every day and improve your muscle strength. And if you can, and if you like, there's a gym in your gated community. Go there and lift some weights, maybe 2 kilos, 3 kilos, and then show off to all your friends who come to the gym with you, or the younger crowd, and make them jealous of you and lift all those weights. But of course, you can also do simple exercises like you do with silver talkies. You can still do some dancing. That's there. But if you have some household activities that you can do gardening. Swimming for the elderly is fantastic because it does not put any stress on you're not lifting weights literally, but there is a very nice activity that you're doing. So if you know swimming and you love swimming, go ahead. All right. One of the things that I did wrong in my life, like I said, I love my father a lot, and we are, 4 brothers. I have 3 brothers. We are 4 sons to my father. And the moment we started, learning how to drive the car, we told my father, "Don't drive. We are there for you. We will take care of you." This is a very, very, emotional thing that we do. We want our parents, the moment we're able to do something for them, we'd want them to stop doing it, and we will do it for them, right? The thing that happened is my dad was a fantastic car driver. He used to drive everywhere, and we'd always, as a family, go, take road trips along. But the moment we stopped letting him drive, in about 5-10 years, he lost his confidence to drive. His reflexes slowed down. He hadn't driven the car in a long time. So he literally became dependent on us to go out, right? So if he wanted to go somewhere, he needed us or a driver to take him out in the car. And this is something which I regret. I should not have done that. I should have allowed my father to continue to drive the car and do what he wanted to do. So he would have remained independent longer, would have been able to do or get around and do whatever he wanted much longer, right? So this is something, right? We have to ensure that we allow our elders to do whatever they want, as long as they are safe, right? That is very, very important. So these are all some recommended time durations, at least 30 to 60 minutes per day of moderate exercise, at least 5 days a week. Okay. But if you're strong and you're doing high intensity, you can make the time half. 15 to 30 minutes is enough for high intensity workout. But usually we recommend 30 to 60 minutes of moderate work intensity, 5 days a week. And what is moderate intensity? Increases your heart rate by little and makes you sweat. That's all. High intensity means you're after the exercise, and you really don't want to be doing that. Even I don't want to do that, right? Just want to increase my heart rate a little bit, and I can sweat, so I know I'm kind of burning off the fat a little bit. Okay. Here there's a nice graduated thing about how you can progress in your weightlifting. No weight first, use your body weight. Maybe use water bottles as light weights, then light hand weights, elastic bands, dumbbells, and then weight machines. So you can progress as your strength level increases, but it's only as much as your body allows you. That is the defining factor, not a gym instructor, not Dr. Tausif. You are the best person to decide how much weight you can carry and do this exercise with. Okay. I always like to tell in lifestyle changes for older adults who are 65 or more, be as active as their abilities allow. Do exercises that maintain or improve balance, because balance is a problem that comes as we lose our muscle, our bone strength, and more importantly, as our nerves become weaker, we have problems with balance. Okay, so make sure that you are indulging in exercises that improve balance. And safety is paramount. And remember, like we said, the bigger problem is risk of falls. So we have to avoid falls. And that is why safety is very important. My battery's on the lower side. I don't know how I missed that. Okay. Yes. Of course, you can do some simple exercises. I'm going to just tell the exercises, then quickly go and fix the battery so I can continue talking. One is chair squats. This really strengthens the muscles of the lower body, bones, and joints. So you can do just chair squats, keep a chair, sit down, get up, repeat this about 10 times, and then do 3 repetitions if you're still feeling good about it. Okay. Don't do 3 repetitions on the first day. It's very difficult. 5 to 10 squats the first day and stop. After a week, 2 reps. After a week, 3 reps. Okay. So do that. This is more simpler. This is stair stepping. So if you have a set of stairs, 1 step on, 1 step off, 1 step on, 1 step off. Okay. So you can do that. You don't have to really climb the stairs, but you can just do it with 1 or 2 steps. But make sure that you have something to hold on to and your balance is maintained and you're not slipping and having a fall here. Okay. The third one is overhead lifts. Overhead lifts are great for your upper body strength and daily functional movement. So, and it keeps your joints supple. Just do with your hands first every day. And then if you can, start lifting some weights, then lift some weights, maybe water bottles, and after that, some weights. So, but overhead, right? So upper body, lower body, and also balance, all 3 you can exercise with these simple exercises. Okay. Of course, this is more important though. Exercise alone is not enough. It is a combination of exercise and nutrition. So you have to ensure that you get your protein intake. If you're a non-vegetarian, yes, you know what protein to take. Fish is great. Fish is fantastic source of calcium. You can also take beans. If you're a vegetarian, you can take beans. They are a great source of calcium and protein again. And then you can do green leafy vegetables. Nuts and seeds, almonds, whatever seeds you like, are great sources of calcium. So this is some dietary changes that you can bring about to ensure you get your calcium requirement, unless you're already taking a calcium tablet. But vitamin D. Now, vitamin D, generally all doctors, and I used to say this to all patients at that point of time, or people used to ask me for advice, that the morning sunlight is the best. But over the last 2 or 3 years, we have now begun to realize that the morning sunlight does not have ultraviolet rays, which are needed to convert the vitamin D on your skin. So today, if you ask people, what is the best time to expose yourself to the sun for getting vitamin D? The correct answer is between 10 a.m. to 3 p.m. That is the right time to expose yourself to the sun to get your vitamin D. Yes, of course, the exposure needs to be only for 15 to 20 minutes, but it has to be between 10 a.m. to 3 p.m., not morning sunlight that we used to always say, right? That is the big change in medical practice that has happened as our understanding of medical physiology is getting better and more different. So this is something that I want to really highlight. Okay. So moving on, unfortunately, in our country, health is not valued till sickness comes. So the more important thing is to diagnosing osteoporosis. And this is where I'm going to talk about what Noura does in terms of diagnosing osteoporosis. So this is Noura, as you all know, AI-based health screening that they have. So screening as compared to routine diagnosis, that is, somebody gets a symptom, somebody has back pain, difficulty lifting weight, or worse, sort of fracture. Then they go to a doctor, the doctor will analyze and then say they have osteoporosis. It's better to do screening. You have to do screening when you're healthy and know if your bones are carrying a risk of osteoporosis or osteopenia, which is bone weakness, and then make sure that you instill measures like exercise, diet, and sunlight exposure so that this can get reversed early. Okay, so that is what screening is all about. I'm sure by now all of you know what Noora is. It's a premium AI-enabled health screening center, first of its kind in India, a collaboration between Fujifilm Healthcare and DKH, using AI and the best of imaging technology to make sure we do great health screening. Of course, this is the first center. This was Bangalore, World Cancer Day 2021, 2022, Gurgaon, 2023 Jan was Mumbai, and now 2023 November is Hyderabad. So Noora is there in 4 places, and I had the pleasure of visiting Hyderabad center. It's beautiful, by far, in my opinion, the most beautiful Noora center in India at this point of time. So why Noora? We know, of course, artificial intelligence, low dose of radiation, and real-time reports. Reports are ready immediately. And they do a lot of fancy things, ultra-low dose CT scan, DEXA, mammo, colpo, oral cancer screening. But I'm going to focus only on the DEXA, only on DEXA, because this is about bone health, right? So this is the DEXA scan. It's like almost a human photocopier, and then it completely scans up to down. But we don't scan all the bones here, okay? So the DEXA is a non-invasive test. It measures your bone density. It is an X-ray, and it allows us to know if there is a risk of osteoporosis or fracture. And today, it is the preferred method for measuring bone and body composition. So that is what DEXA is used for today. And today, any osteoporosis specialist or bone specialist who is treating for osteoporosis will always ask you to get a DEXA. Any orthopedician worth his salt will do that. And it's very quick, painless. You just have to relax, lie on your back. No preparations. You can eat your most favorite meal and come, no problem. You can still do it, right? And the whole radiation dose is similar to the normal background radiation you're getting from the Earth's surface. That's all. There's no extra scary, dangerous radiation exposure at all. It's like if you're just taking a walk every day, whatever radiation exposure you'll get is the same that you get from the DEXA. And of course, we look at the spine and the femur at Noora. We can look at 4 bones or 5 bones in DEXA. We can look at the spine and the femur. We can look at the wrist. We can look at the ankle or the elbow. We can look at all of these bones. But the most preferred are the spine and the femur, or the hip, as we call it. So this is how the report comes. So on the left of the screen, you're seeing the hip bone, right? So hip bone. So we scan that, and there is this red, yellow, green. It makes us easy to understand whether how good or how bad I'm doing. That white spot there with that line, dotted line down, that is telling where the person who's getting screened, their reading is. Those 3 lines indicate what's normal for that age. And this is depicted using something called as a Z-score. And on the left, of course, on the right, my right, is the spine, right? And there's a T-score and a Z-score. What is this T-score and Z-score? A T-score is if I take from the population 100 people who are 60 years old, what is the expected bone strength for them? Based on that, where do you stand when you screen? That is called a T-score. Z-score is if I take 100 Indians and then I screen their bone, where would you stand compared to the population's bone density? I mean, because different ethnicities, like I said initially, your genetics determine how much bone mass you're going to have. So obviously, Caucasians will have a little more bone mass and a higher risk of osteoporosis. Indians may have lesser bone mass, but also lesser risk of osteoporosis. So based on that, we do a T-score and a Z-score and tell people what is their risk of osteoporosis. And the number to remember always is 1 and 2.5 and minus. If they are greater than minus 2.5, that is osteoporosis. Between -1 and minus 2.5, that is osteopenia, that is bone weakness. Less than -1 is good. Less than -1 means you're safe. Your bones are not at risk of fracture. So we did this screening at Noora Noora's data. This is about 3,500 people. About 17% of the guests had signs of bone weakness. 17% of healthy, normal individuals without any symptoms, right? And 2.4% had osteoporosis, making them prone for fractures. That means out of 100 people, 2.5 people are going to have fracture, of a risk of fracture, high risk of fracture, right? Or you can say out of 205 people. And then females have a higher rate of osteoporosis compared to males. This we already know and explained to you why that is happening. That's because of menopause. The bigger problem here is we are noticing this in people as young as 30 years old. It's not about people at 50. We are seeing this at people at the age of 30 itself. So that is how poor a lifestyle we are living now, across. When we look at femur, not so much of bone weakness. That is why screening the spine is better, because it is a better indicator to find out. Femur, if it is normal, it may still be deceptively, hiding that the spine is weak or the other bones are weak. Okay. And here, femur, even at the age of 20, we are seeing weakness. And this is Indian data. That was Noora data. This is India's data, is also showing that only about 40% of Indians have good bone strength. That is shown in the red. Remaining either have bone weakness, and 10 to 15% have osteoporosis, right? So that is the problem in India also. So in Noora, of course, they do all of these imaging and tests, right? And then they send it through the AI, which they do for the DEXA also. And then they bring it to the doctor in about 120 minutes. Everything is ready. And they do all of these tests. So it's not just the DEXA that they do. They do a lot of tests put together for screening, which is really, really useful for you, like this cancer screening, and then lifestyle screening. And lifestyle screening has your DEXA and your body fat composition and so on. And now we're doing genetic screening also, which also checks for osteoporotic risk or bone disease risk. So the genetic screening can also tell people what is their risk of developing bone disease. Right, as you can see at the bottom, there is gout and osteoporosis right there. So yes, like I said, we started off in Bangalore, went to Gurgaon, went to Mumbai, and now we are in Hyderabad. Also, they are in Mongolia as well. Right, so they're going to Mongolia. They're doing great. The Mongolia center is already busy, and it's encouraged Noora to grow across to other parts of the world as well. So they went to Vietnam, Dubai, across the Middle East and Southeast Asia. So that's all that I have to say in my talk today. So I welcome you once again to the Noora way of life, and I welcome you to choose health.
So we'll dive straight into making this interactive. Nand, please unmute yourself and ask your questions. I know you had quite a few.
So do I ask all of them or one by one?
One by one will be great, but yeah, you can cover all.
Okay,
It
no,
depends on how many I can answer.
No, I'm sure it's child's play for you. There are certain terms that confuse me. Bone mass versus bone density. Are they the same thing or are they
Yes.
different?
So bone mass basically is how much calcium hydroxyapatite, the mineral that sits in the bone mass, is sitting in the bone. But density is how closely it is packed. So technically, it is the same. When there is more bone mass, the density will increase. That's the idea. Lesser bone mass, lesser density.
Okay. Then, in one of the charts where you were showing lists of causes for osteoporosis, I found diabetes missing. So that was a comforting thought because otherwise, diabetes is a culprit for everything. So I hope it's not related to bone related issues.
That is correct. That is correct. So diabetes is not related, thankfully, does not hurt the bone. Diabetes does not, but diabetes will reduce your muscle mass, right? So when your muscle mass is reduced, then what happens is your level of physical activity is coming down. That will then affect your bone mass, right? So indirectly, that will happen. But diabetes per se, like it affects the nerve, the kidney, or the eyes, it's not going to affect the bone. It's just the loss of muscle mass that will hurt the bone. The disease that will really hurt the bone is kidney. People who have chronic kidney disease lose bone mass faster, right? Yes, because one of the components of vitamin D's activation is the kidney. So that is hurt in that process. So they have a higher risk of osteoporosis.
So now there is this contradiction I find. One is encouraged to have a lot of calcium for good bones, and then one is also told that it can lead to kidney stones. So, how does one balance this?
Right. So that's a good question. See, everybody who takes a lot of, how do you say, calcium will not develop kidney stones. Okay. It's all there. People have a genetic predisposition towards developing kidney stones. These people can develop kidney stones, whether or not they take calcium. Sometimes the calcium is just a trigger for that. But otherwise, you and I, who've not had a history of kidney stones, which is the probably about 80% of the population, are not going to suffer from kidney stones because we are taking calcium, right? And the first port of call for calcium, that when you have your calcium, is going to be bone, because 98% of calcium in your body is in your bone. Only the remaining 2% is in the bloodstream and is going to different places like muscles and cell membrane and doing all the reactions that they are supposed to do. So it's the bone that is going to store it. That's the idea. Does that answer your question? So don't worry about taking calcium. It's not going to cause kidney stones in
No,
everyone.
someone told
Yeah.
me that it is not the calcium by way of diet that is damaging for stones, but the supplements, extra tablets, etc. one takes. I was told that is avoidable. Is that true? I mean,
No.
diet supplements and
If your diet is great, and if you, so I'll tell you how vitamin D and calcium works. Okay. You take calcium either as diet, or that's almonds or green leafy vegetables or fish or anything or meat. You take your calcium source, it will not get absorbed. It will only get absorbed if you have active vitamin D3 in your body. And for active vitamin D3 to be there, you have to have you expose yourself to sunlight. If there is no active vitamin D3 in your body, how much ever calcium you eat, it is going to come out through the gut. Yes. It's not going to get absorbed through the gut. It's going to come out through your stools. Yes. So this is the problem that will happen, first and foremost. So there are two things here. One is, if your diet is great and your vitamin D is great, you don't need these supplements. But if your diet is poor and you're not getting enough source of vitamin D3, you don't have a choice but these supplements, right? So that is where it's the benefit ratio. And there is no evidence which says that if you take supplemental calcium, you will develop kidney stones. No. Kidney stones will develop only in people who are predisposed to kidney stones. And it's not been shown, not been proven that it comes because of people taking calcium supplements. No. Like older people don't develop kidney stones because of calcium supplements. But if a younger person is taking unnecessarily high doses of calcium through calcium supplements, then yes, obviously he's putting himself or herself at risk for kidney stones. So you should only take calcium as per your requirement. That is the idea. Does that answer your
my
question,
last
sir?
question. Yeah, thanks. My last question, what's the difference between arthritis and osteoporosis? Or are
Right.
they one and the same?
They are not one and the same. They're very different things, in fact. Osteoporosis is where the bone, you see the long structure which they show in the movies always, the bone is becoming weak by itself, right? It's not strong anymore. It's, developing cracks, if you can understand that. Arthritis is where two bones meet. At the point where two bones meet, like a joint, there is wear and tear. The bones can still be strong. The bone need not be weak for this. It is the wear and tear at the point where two bones are meeting, where there are cartilage and there's a synovial fluid which is acting as a shock absorber. There is wear and tear there. So that rubbing point, so bones start coming closer and closer to each other and start creating trouble because they start rubbing against each other. Ideally, the cartilage and the fluid should prevent that, but that is happening. But the bone can still be strong. They need not be, people having arthritis need not have osteoporosis.
Yes.
Right.
Thank you. Thank you, doctor.
Okay. Thank you. I answered them. Yay. I'm so happy.
Yes,
Who's
you did.
next?
And I think there are questions from Vatsala, but I think somewhere in your talk you've already answered that also with whatever Nand asked. So, where she says, post 55, how often should we take calcium tablets? Which you have mentioned, tablets are not really needed if there's enough absorption and you do have your diet right. Correct? But you could
No,
answer
but
her question.
older people, there is problems with diet in older people. They're not able to eat everything because of whatever medical reasons they may have. So when older people are unable to have a well-balanced, healthy diet, calcium supplementation along with vitamin D supplementation really helps them, right? As long as you've maintained a great diet and you've come to this phase healthy, you can even check your vitamin D and calcium level. If your vitamin D and calcium level are fine, then you can continue with your diet and sunlight exposure. But if you feel it's a little off, then you might want to supplement, right? So you can go with, make an informed decision rather than a blanket one size fits all rule for everybody.
That's right. So it's not for everyone, because she also asks what's the frequency of vitamin D. I'm guessing each one, it depends on what's required for their intake, right? When it comes to
Absolutely, absolutely. Yes.
What are the foods that we should avoid?
Food. So technically, we want to avoid high phosphate containing foods, right? Usually, there's not much that's there around, so it's not going to really trouble you. But if you are eating anything that seems to be rich in phosphate, I'll then tell you why phosphate is a problem. Because what happens is the calcium and the phosphate bind and then get excreted out instead of going and sitting on the bone. So we try to avoid anything that's rich in phosphate, but your usual diet will not really give you so much of phosphate unless you are specifically taking some sort of a supplement which increases phosphate for you, right?
Can you
So
mention some of them?
it can be some dairy products usually. Yeah, dairy products may have, and that's also processed dairy products. Your natural your natural food usually does not contain this. Sometimes you can take processed food. Processed food have different kinds of salt that they use for preservation, and sometimes these are phosphate salts, right? So if you're eating a lot of processed food, there is a risk that you may be pushing yourself towards osteoporosis because it will not allow the calcium to get deposited into your bones. So cholesterol is not the only problem with processed food. Bone strength issues may also come. So that's one common thing that's there. Other than that, any natural diet you're taking, you will not have such high levels of phosphate at all.
Nowadays, there is so much talk about milk. Like milk is not required for bone. One doctor says you don't need milk. Another doctor says, how can you stop milk? You should have milk. So what exactly we are supposed to do?
Well, you should have milk. Milk is good. Milk is a very good source of calcium. What happens though is today we don't drink only boiled and pasteurized milk, right? The whole process of getting milk from the cow, boiling and pasteurizing, was to ensure that we avoided infections from the cow's gut, especially TB. So it used to be bovine TB, which then will, affect people. So we had to boil it at a certain pressure, 100 degrees Celsius plus, and then drink it. But today, for longer shelf life, we have more processed milk coming. So this processed milk is then also creating allergies, and people are becoming lactose intolerant and then passing on genetically to their children who are also becoming lactose
An
intolerant.
interesting point.
Other than that, milk is good. Milk was never bad. It's only today's processed milk which is creating reactions and now becoming a problem. But of course, some people do develop, allergies to milk or become lactose intolerant by 40, 50, and they can give them gas or acidity. Yes, in that situation, you can avoid. But milk is not bad for health.
Okay. Okay. Thank you.
Sure.
Doctor, another question. Does excess calcium turn into calcium deposit?
Very interesting question. Usually, how the body responds to wear and tear is by depositing calcium there. You can think of it as cement on a wall that is cracked, and you are putting cement to make that wall normal again, right? So when there is wear and tear in the human body, the body will try to repair it. If it does not get repaired or we are unable to repair it, we will get away by putting cement on top of it, or rather calcium. Sorry, we're putting calcium on top of it. So if you're going to see calcified arteries, that's only because wear and tear has happened there, and we have lost our ability to regenerate so much that the body is now introducing calcium as a stopgap. Okay, so this is a normal process which the body does as we age. Now, can it get deposited because of having excess calcium in the body? Now, this is where the question of the supplements come in. A young person who does not need so much of dietary calcium, they take a lot of calcium, excess calcium over a period of months. Obviously, this excess calcium will get deposited somewhere. Okay, so this is rare. This is only seen when you see the person's calcium level go above 12 or 13. Normal calcium level will be about 10 to 11, but if it goes above 12 or 13, in that case, yes, these people can have it, but it is a very rare situation. Does not usually happen. But in older people, calcium deposit will naturally happen whether you take calcium supplements or not. That is the body's way of trying to protect itself when it's not able to heal. Does that answer the question?
Yeah. Thank you, doctor. Also, I think Nakul has a question. Does getting annual bone density tests really help?
Absolutely. It is like you go to school, you study the whole year, and you write your annual exam. And you know, oh, did I study well or not? Right? So that's how it is. So obviously you do the test, or you know whether you took care of yourself or not, and then you gear up for the next 1 year after that. So that's important to do. Yes.
There's a question related to milk, which Shaila had asked. Does that mean that processed milk products are harmful?
Any processed food product is a gray area because you're not really sure what they put into the processing. And you can be rest assured that it's not natural, right? So your body should then not only digest the food item, but it also digest the processing chemicals or solution that was used to keep that food item healthy or fresh. So your body is now digesting two things: the food item itself, and also the whatever substance was used for processing. It's going to digest it. How your body is going to react to it, only your body knows, and we don't know how that works. Yeah. So anything that's processed is not really healthy.
It boils down to making fresh food. That's what you're saying.
Absolutely, yeah. Fresh food is always been great from our
tin
childhood.
stuff and all one should avoid. That's what it sounds like.
Exactly. Only thing is today fresh food is sold as organic with 2 or 3 times the price. So that's also a big problem.
Go back to grandma's cooking.
Yes, exactly. Yes.
Satish wants to know what are the resistance exercises using body weight?
Oh, it depends on your own ability, how much you can do. So there is a complete calisthenics. You can Google calisthenics or a set of exercises which use your own body weight. But age-wise, they will be different, right? To avoid the risk of injury. So age-wise, they'll go. So the calisthenics is what you need to Google for. And all of the calisthenics exercises use your own body weight. It's about graduation. Like I said, first use a chair to just do the squat. Once you're so good, then you can remove the chair and do the squat, right? So it's just about gradually pushing your body till it can become stronger without suffering an injury. So that's the idea. Like I said, simple things are pushing. First and foremost, simple things are upper body, lower body. I said, sit to the chair, move your arms up and down. Then you can start using, weights or use your own body, like push against the wall. You can do those things. So it will help. Age-wise, different calisthenic exercises are there, which we can use.
Thank you.
I cannot enumerate all of them right now, and I'm not even an expert on telling you what are all the exercises that we can do. But there are many things. Your guiding factor is to make sure that you don't suffer an injury. That's the idea.
Okay. Shaila, if you're here, could you ask your question? I think she's talking about she's done a screening at Neura, but it did not show the deformation that started in the knee.
I did my screening at Neura in 21, and I wasn't aware about so many things. It was my first screening. After a few days, like last year, then in my shoulder, that rotator cuff, what we call, there I lost tendons. It's complete tear of tendons. And then in my MRI and after MRI and all, doctor says that it looks like that you have arthritis and your bones have become very sharp, because I didn't remember that I have made any accident or any injury. It didn't happen. Then how it got complete torn, like complete tear of the tendons? It can happen only after the injury or accident or something like that. That was he was saying. Then another possibility he said, because it might be like that you have arthritis and your bones have become so sharp that chances are there that it got cut. But there was nothing in neura report that I have some kind of thing. Then again, last week also I have my neura screening. I asked this question when I had gone for consultation, that little bit of deformity has started in my right knee. I had gone for my other problem to orthopedic and it started, but we are not sure that how long you will be able to manage with that. It can come to surgery stage within 2 months or 6 months or 6 years also. But those kind of things we are not getting in neura reports,
That's correct. Here I'm going to thank Mr.
And
Nand
I
for
feel
asking
that
that
that's very
question in the
important
beginning.
to have that kind of feedback.
I know. I completely agree with you. And this is something that I've been pushing the Japanese to find a reliable way to diagnose. And what you're talking about is arthritis. Neura diagnoses osteoporosis, but it does not diagnose arthritis for the simple fact
Yeah.
that we need a reliable test that can screen for arthritis. And Noora is working on it. This is one of the few directions that I've tried to push Noora in. One is arthritis, the other is stroke, and a few other common conditions we feel are important to diagnose. But unfortunately, at this point of time, Noora cannot diagnose arthritis. It is at the moment focusing only on diagnosing osteoporosis. And hopefully in future they will diagnose this. That's the idea.
Feedback I have given that it should be added into the screening.
Thank you, Shaila.
Absolutely. Yeah.
I
Thank you.
see Hannah has raised her hand. Hannah, do you want to ask your question?
Yes. Yeah, good afternoon, Dr. Tausif. How are you?
Good afternoon.
Good afternoon. Doctor, I just have a quick question. I am lactose intolerant since a few years. Actually, the thing is, I was in the Middle East, but I never had this lactose intolerance problem there. I used to maybe, then when I came back to India, roughly 4 years back. So whatever milk I've tried different types of milk. It doesn't suit me. So I have quit on the dairy products. But there is curds like, probiotic curds that doesn't affect me. But the milk is on the higher side that affects me. So can you just tell me what are the substitute I can go with to avoid the dairy and, which can compensate the calcium needs for the daily requirement?
Right. So dairy is not the only source of calcium, right? In fact, when I put the slides, I did not even mention dairy. Yes. But if you are a non-vegetarian, then fish and meat contains calcium. If you're not a non-vegetarian, if you're a vegetarian, then nuts and beans and seeds and green leafy vegetables, they all contain calcium. So those can supplement your daily calcium requirement every day. And of course, on top of that, you'll have to expose yourself to sunlight and ensure that whatever calcium you're taking is getting absorbed 100%. Then you can get away from the dairy requirement for calcium.
Right.
As long as you're
also, I was taking this, I was taking this vitamin D, which is, I think, 50,000, which used to be taken once a week. So can I take that once a month instead of taking every week? Can I take that once a month to maintain the
You are supposed to take it only once a month, 60,000. It's not 50,000.
60,000, yes. Yeah,
60,000 units once a month is the recommended dose. And even that we take only for about 4 to 6 months. And we hope that your vitamin D come up to a certain level and it can maintain by your regular exposure to sunlight. That's the idea. The once a week for 4 weeks is given to people who are deficient, quite deficient in vitamin D, as a quick measure to bring it up to speed, and then maybe do once a month for 4 months and then stop. Right? But the recommended dose is only once a month.
Once a month. Okay, fine, doctor. Thank you so much, doctor. Thank you.
You're welcome. Yeah.
Hope that answered your question, Hannah.
too much of vitamin D is also bad. Huh? Not like vitamin C or B, which you can take as much as you want of vitamin C or B and it will not hurt you. But don't take excess vitamin D.
Yeah, sticking to the vitamin D topic, I think Delia, she said doctor, you did mention sunlight between 10 a.m. to 3 p.m. is best for vitamin D, natural source. Could you also let me know for how many minutes in a day?
About 15 to 20 minutes.
Okay, 15 to 20 minutes.
I think I did mention at that point, but yeah, I'll reinforce. It's 15 to 20 minutes between 10 a.m. to 3 p.m. That's more than sufficient.
I know you showed us a few exercises in your PPT, doctor, but Lakshmi wants to know, are there any other exercises that can be done indoors?
There are many. That's why I said look for calisthenics, body weight exercises for the people. There are many more. What I showed was 3 simple exercises that work on 3 important aspects. That's lower body, upper body, and balance. If you can do these 3, that's great. But then there are exercises which focus on other parts of the body also, just the leg, just the arms, and so on. It can be done, right? Unfortunately, I'm not having all of that with me right now to tell you. Different things we tell different people depends on the body part that we want to train. Back exercises, knee exercises, neck exercises, arm exercises. There are different ones that we can tell people to do.
Right. Daisy, I will read out Daisy's question, though I guess that is more person to person. Her question is, does everyone who have knee issues go in for replacement? And at what point of time is surgery required?
No, everyone who has knee issues does not go in for a replacement. In fact, we try to push knee replacement till it cannot be further avoided, simply because the lifespan of the joint or the prosthetic joint that we use is only about 10 years. But if you take care of your knee well, maybe you can push it to 15 to 20 years. So at whatever age you do the knee surgery, then you're looking at a 10-year great knee. And if you've taken care of it well, it's another 15 to 20 years. So we try to make sure we do it only when it is really required. And it becomes really required when you cannot walk without suffering pain in your knee. You're not able to freely flex your knee. It's like becomes fixed, right? And even when you're sleeping and at rest, the pain is quite severe and does not allow you to sleep, is when we then advise, okay, maybe it's time for you to replace the knee. This is some of the things that we take into consideration. And also, of course, the ability of the person to be able to handle the knee surgery and recover from it quite well. That is also important.
Right.
Yeah.
Lalita has a question.
Sorry,
Lalita has a question. Does chemotherapy drain calcium in the body and lead to osteoporosis?
Yes, it does. Unfortunately, it's not by virtue of draining calcium. It's by virtue of attacking cells that are rapidly multiplying. So chemotherapy works on the principle that cancer cells are rapidly multiplying cells, rapidly growing cells. So it attacks cells that grow rapidly. But along with cancer cells, it also hurts other rapidly growing cells in the body, like the bone. As you know, the bone marrow constantly is developing and making sure we're getting enough RBCs and white blood cells and red blood cells, and blood is constantly produced and so on. So it attacks the bone, right? So that by itself will cause the bone to become weak, because then the bone has to go into a cycle of constant remodeling. Like, it has to build, get destroyed, build, get destroyed. So obviously it'll make the bones weak. So that's how it attacks the bone.
Right.
Per se.
Is there a time frame for taking calcium supplements?
There is no time frame. Usually, today's medical practice, we give calcium to everyone who's above the age of 50. But we also over time realized it's vitamin D that's important. And also now we've realized it's not just vitamin D and calcium. The bone, like I said, is in a constant state of remodeling. So we have to ensure that we have something which is anti-osteoclastic, meaning anti-bone eating substance. We are trying to stop that as well, so that you don't need so much calcium, right? So medical practice, even as we speak with relation to bone health, is changing the way it looks at it, giving it a lot of importance, and also changing thoughts that we have. Like I simply said, before you say go in the morning sun, now we know it's in the afternoon sun. So like this, it's changing at this point of time. So there are other medicines which are helping
What
us.
would be the approximate requirement of calcium?
For a person, you can take about 500 to 600 milligrams of calcium a day. That should be more than sufficient a day.
That's lifelong?
Should
we have, yeah, should be.
After a certain age, yes, ma'am. If in case you're not able to get it from your diet, you can. But the best way is once a year, check your vitamin D and calcium and see if it's normal, then you should be able to do with your dietary sources if it is normal. And if your bones are strong. Your DEXA report is strong. DEXA is good, no bone weakness. Your calcium levels are good and your vitamin D is good, then you stop the calcium. You don't necessarily take.
So it's the same case for after chemotherapy also. You have to check the calcium and then...
Calcium, DEXA, and vitamin D. You get the whole picture. So then you can stop.
Okay. Thank you so much. Thank you.
How about steroids? Because many inhalers have steroids. So how do you balance that?
Steroids are not going to help your calcium levels. They're going to make your bone weak. Either you have to stop the steroid or you have to ensure that you keep your calcium and vitamin D uptake high.
But if one is to compulsorily take inhalers, what do you do? There's no option.
Then I would, if I have to compulsory, God forbid, take inhalers, then I would definitely exercise actively, spend more time in the sun, ensure I have a great diet. Okay. This is what I would do. Yeah.
There's a question from Kanchana: would processed dairy mean butter and cheese?
Alexa, put on all the lights up.
No, yeah, it's technically no. Yeah, that's no. Processed dairy is processed milk. Butter and cheese, which you get your Amul butter, they don't really classify as processed dairy. If it is processed, then it will mention it on the. So the good differentiator is things that expire fast are not processed. Things that stay for a long time probably are processed. So you can always read the ingredients and see what's been put in there. And FDA ensures, if you're in the US, they have to show everything that they put in. In India, our standards are not so strong, and people also get away by just writing Agent E, Agent I, and so on, and then get away with it. So please look at the package, see what it is, and then you can take a call yourself.
Ramesh would like to know, does curd and buttermilk have the same amount of calcium as milk?
That's a very good question. Nobody's asked that to me before. Unfortunately, I don't know the answer to that one. I don't know, honestly. Okay. I'm assuming it does, but I really don't know. Yeah, I don't think buttermilk will have the same amount of calcium, but curd should have.
Okay. Question from Kanchana again. What's your opinion on taking vitamin K2, MK7 with vitamin D3? Because there's been a lot of debate on this.
Vitamin K2 has not been yet proven to show any advantage of removing calcium deposit from the heart. So the evidence is still out there. We don't know if it's necessary or not necessary. Maybe at a later stage, we may be able to confidently tell you whether it will help you or not. But at this point, it's all just experimentation. And I wouldn't advise you to do trial and error at all. Unless the medical world is confident about what they're prescribing, you shouldn't be doing self-experimentation is what I will tell you.
Okay, I seem to have missed one question from Shakuntala. She says, I got an A in the Neura-DEXA scan in April this year, I'm guessing, but have been recently diagnosed with osteoporosis of the wrist.
Okay. So like I said, we do scans for different parts of the body, to check osteoporosis. One is the spine, then the hip. We can do the ankle, the elbow, and the wrist. Out of these, the spine is supposed to be the strongest indicator. But if you have, let's say, decreased physical activity on, your leg or your hand, there is a risk of your bone in the leg or hand developing osteoporosis, but your spine still remaining strong. Okay. In that case, unless we do a scan for the wrist, we will not be able to tell you whether there is an active osteoporosis or not. We will only go by the, spine and the femur or the hip and say whether you have osteoporosis there or not. That's the information that you will obtain. If you want a full osteoporosis scan, then you'll have to do spine, hip, elbow, wrist, and the ankle. That's, at this day and age, medical science says that is the full osteoporosis, which we do for people who are at severe risk of osteoporosis or under treatment for any other bone conditions. That's what we do. So that's how that might have been missed. Because your spine might be strong, probably your wrist is quite weak.
Makes sense. Thank you, doctor. I think Nagraj would like to know, can yoga and pranayama help improve bone density?
I'm not an expert on yoga, but my assumption is yes, because of two things. One, it exposes you to sunlight. Second is it's a lot of exercise and stress on the bones, so it should help your bone strength. Does pranayama do it? I don't know, because breathing seems to help everything. So maybe, I don't know, honestly. Yeah.
Right. Question from Swati. We are living 20 years longer. What advice can we give our younger family members for bone health? I'm guessing it's...
No, exactly what I showed in the first two slides.
Yeah. Right.
That you reach your genetic peak bone mass by the age of 30. And the only reason you will not reach this is if you are having an unhealthy lifestyle before the age of 30. And that is what you must avoid. You have to have a healthy lifestyle before the age of 30 for you to reach your peak potential. And that's important.
Tablets, they cause very aggressive constipation. So do you recommend anything which has a milder effect on anything like that?
It is a very person-to-person thing, ma'am. It's not that this particular tablet will cause constipation for everybody. It's about how your bowel reacts to it, especially calcium and iron tablets. A lot of people can sometimes react in such a manner. So you will have to, on a trial and error, look at different brands and see how they go, and then see if what works. That's the only way. But if it's generic for all calcium, then you'll have to figure out how in what other form can you get these sources? Can you get your calcium source? Yeah.
Right, doctor. Thank you, doctor.
For session. Thank you so much for joining us.